Hey there, Myo family, and welcome back for what is guaranteed to be a rousing conversation. Many people that I have worked with or met over the years have never heard of the connection between ADHD and sleep disordered breathing, most commonly sleep apnea. So we're going to be talking about that today. But first, let me introduce myself if I'm a new face to you. My name is Carmen. I am an orofacial myofunctional therapist. I have a large global myofunctional therapy business that works 100% online. So my team and I are able to bring this important therapy to all corners of the globe. So we work with people, really, I call it wellness because I also am a nutrition therapy practitioner. So I work with clients basically that take them from feeling like crap to feeling much better. And so whether we do that through nervous system support, breathing, tongue tie prep, sleep promotion, all sorts of different things lead back to Rome. Oral rest posture, tongue thrust, that kind of stuff. Chewing and not chewing and swallowing correctly. So all of those things affect the wellness for somebody. So that's what we do. Our sweet spot and passion is the airway, sleep, and wellness. Okay. So today I'm going to be talking about the connection between ADHD and sleep disorders. I also want to make sure that I deliver this information to you in a way that is easy to understand, not super research papery. So there is plenty of research out there. If that's what you want to go do, if you want to read research and it's your jam, then Dr. Google is going to be for you. But I'm trying to make this really just low level for parents to understand. So when it comes to ADHD, attention deficit hyperactivity disorder, I'm often asked how I'm seeing this in my practice. I have worked with what some would say are very naughty children. But when I met them, I knew that there was something else going on. And I know that, of course, because I see and have helped so many kiddos. The thing with children is that many children with behavior problems, they're given a label and they're given a medication instead of the courtesy of a deeper dive. That's what I do. Like, okay, what's going on with Johnny? I have recently had clients who have been suspended from school more than they have attended school. I've had kiddos as young as 6. That's as young as 6, you guys, that have spent over half of their education hours not in the classroom. So outside, in the principal's office, that kind of stuff. So these are kids that are in primary and middle school. What's it going to be like if we ignore this and they reach high school? Is there going to be a place in society for these students? What happens when they get out of high school? Will they finish school? Will they become a dropout statistic? You should see the relief that comes across the parent's face when they learn that maybe there's a reason that their child has such challenges. An overwhelming majority of children diagnosed and medicated for ADHD have sleep apnea. And if your child has behavior problems and is being treated for ADHD, then I would encourage you to schedule an appointment with a doctor to talk about the referral for a sleep study. And I'm not sure if I put it in here. Let me look at my notes. I don't think I have it in here, but I'm going to tell you guys what is really life-changing for a lot of my clients is I have them watch, there's a video out there called Finding Connor Deegan. It's mind-blown. And it just shares the transition about a child who is in a very dark place, not good. And they find and fix his issues, his airway issues, his sleep apnea concerns, and he changes. It's like a new kid, and he's got a new lease on life. I have all my students watch it. I really recommend it if you have a kiddo who you're suspecting this with, okay? So to prepare for this, I did some research. So the first PubMed article I pulled up said that attention deficit hyperactivity disorder, so ADHD, is commonly associated with disordered or disturbed sleep. So do we talk about that? Do we talk about that in the doctor's office or at the school? So what is ADHD? So most of us know this, but to make sure, it is a common neurodevelopmental disorder that has been estimated to affect approximately 5.3% of children and adolescents worldwide. So that's not a big percentage. I would say it's probably more, but that's just me saying, oh gosh, I see it so much in my practice. But I also do have to remember that I am the end of the desperation highway for a lot of parents. So inattention, hyperactivity, and impulsiveness, so making those poor decisions, are recognized as the symptoms of ADHD according to the current diagnostic criteria. But in a nutshell, these people, children, adults, they have trouble day to day. They have trouble functioning day to day. So what makes it very difficult is that it is diagnosed through the observation of parents. If the parents don't suspect that there is a sleep concern, then this might be where the disconnect is. I've had many parents who say, oh, I suspected that something was wrong, but I just could never get an answer. I know that I had a family member in the same situation, and we talked about the screening that she went through because she was trying to get her kid diagnosed so she could get a medication, hoping that he would change and be better. And it was very vanilla. It didn't dig very deep. It was just asking about her experiences. So that was really hard. In my practice, I have also had several instances where the parent has been told, no, the child doesn't have ADHD. So again, my family member. But the parents knew, they had this gut feeling. It's just kind of a niggling there that they know something is wrong. I know it's more complex than this, but when we have kiddos who are just outright struggling and they're having trouble in school and they're having behavior issues, it's time to dig deeper. It's not that parents want a label or a medication for their child. They just want an answer. They just want some solutions. They just want things to be better at home so they're not constantly at war with this kiddo. So this is where kiddos tend to get misdiagnosed. Problems with sleep, however, can lead to ADHD or ADHD-like symptoms, and this can potentially result in misdiagnosis. The effects of restricted, disordered, disturbed sleep can manifest as symptoms, behaviors, functional impairments, those that are similar to ADHD. And the interrelationships are further complicated by the use of medications to treat ADHD, which will then impair sleep in some patients. So I picture like a dog chasing its tail. Like, okay, my kid's taking medication for ADHD if it's impairing the sleep, but if the sleep is causing the ADHD, like how do we know? So it's for this reason that it's recommended that sleep disorders be ruled out before a child is actually started on medication for ADHD. To drive this point home a little bit more, some countries out there are pretty bum diggity. We're not. Here in the United States, we're not. Some other countries require that a child have a sleep study and be screened for obstructive sleep apnea before being treated for ADHD. And I think that's incredible. So what should you do if you're feeling a bit of tug at your heart with this? Am I talking about your kiddo? Am I talking to you? Because 2/3 of childhood ADHD diagnosis and symptoms follow people to adulthood. I meet tons of clients who are being medicated for ADHD still to this day. And oftentimes a lot of those clients do go on to get diagnosed with sleep apnea. So I think overall that it just warrants a deeper conversation with a highly trained sleep doctor, which can be tricky because some are more up to date than others. But the biggest thing is getting that conversation started. Don't just sweep it under the rug. So I think that's just the best starting point. So if this is you and you have questions about your kiddo, if you have questions about you, the best place to do is to go to my website and get an exam scheduled. That's the first place. It doesn't help to send emails because I can't answer anything about your case until I know something. So once we do an exam, then I can kind of dig and know more and understand more, and then I can help you build the roadmap. So I always say I'm the tour director, and I help create the itinerary. I can tell you, first step with kiddos in this situation is to talk to the sleep doctor to get a sleep study. Do we need early intervention with airway focused orthodontics? Anytime we have a kiddo that's having airway concerns, that's the route. We need early intervention to get the bones of the face and the airway growing properly. So that's really the base level. For adults, we don't just want to medicate and mask over it. So if there's sleep concerns, just because you always have slept like shit doesn't mean you got to keep sleeping that way, okay? We have to figure out what's going on. So I hope that's really helpful. I have a feeling this will be a real hot button for parents, especially some that, just have some questions. So make sure to get that exam scheduled so we can continue the conversation. This conversation about sleep, the last few episodes have been about sleep disorders. It has been great. Hopefully it has taught you something, and we will continue these important conversations in the future. I'm going to let you go, and I'll be back next time with another hot topic. Bye for now.